Okay, so I have been like a little curious stalker wanting to know your story because I feel like in social, you have hinted at certain aspects of your fertility story, and there has been like snippets of the journey, but I don't, it would be really creepy of me to just sit down and piece all of your story together. I'm not above it. I would do it. I would.
I love
but
you.
I probably shouldn't admit that on something that's being recorded. So I'm going to pretend that even if I hadn't done that, that I'm getting it from you right now instead. So
Okay.
just dive on in to where you feel your most natural beginning would be for your fertility story.
Okay, so let me think. Just to rewind for context, anyone listening, I am 42 and a half, turning 43 this year. And I had my kids at 36 and 38. Got married in my early 30s and, thought, oh, I'll wait a couple years. And then when it was time and when I felt sort of more ready to have a baby, it wasn't happening. And I had always had an inkling, and I'd also been fortunate to get advice from some other women to say, look, if it's not happening within 6 months, like just go get some stuff checked out. Don't just like wait a year. They tell you to wait a year, but they're like, so at 6 months, I was like, I'm going to go get some testing done. And everything came back completely normal. And then they were like, well, let's go test your husband. And that's where we noticed that there were some major issues with male factor issues, like motility, so sperm not swimming well, morphology, and DNA fragmentation. So like the full trifecta of stuff.
Yeah.
And it was really hard, I think, in that moment because it was presented to us as it's his fault. Like that's pretty much exactly what the doctor said. And it was more like, well, we now know what the issue is. They didn't say it's his fault, but I remember very vividly being in this fertility clinic, having this sort of interview after going over the results and them saying like, turning to him and being like, we know what the issue is and here are the issues, boom, 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 boom. And I remember feeling in that moment just so hopeless and so in the sense of like, I've always kind of been that person that was like, if I'm healthy enough, if I eat the right things, if I do X, I should get Y. And I realized that I had zero freaking control over this issue. And I also could anticipate that it would potentially cause some friction in our relationship because, I'm the kind of person that's like, have you had your vitamins today? Like on a good day, let alone like during fertility where I'm like, have you had your greens? Like, did you eat enough protein? Like, that's just my default. Well, you can imagine what that would be like being married to me in a scenario like this where I am by far the healthy person in the relationship, right? And I say that in terms of like just being into that fitness lifestyle. Like that's what I do. I'm a Pilates instructor. I've been in fitness for 2 decades. So it was a huge slice of humble pie and also a huge moment of sort of trying to navigate something where it felt like the two of us were not really on the same page.
Right.
So yeah, freaking not easy. My gosh, where do we go from here? There's so many directions I could go, but basically,
do you remember what his what the recommendations were with regards to his DNA frag, the morphology, the motility? Like, were any lifestyle changes mentioned? Did they do any testing with regards to whether there was a varicocele or an infection, or was it just straight to like, we'll just do ICSI?
No, we did testing. So we saw a guy, Dr. Jarvie, I think.
Oh, yeah. Neurologist.
Yeah. So he's a real well-known guy in urology and no varicocele. So there's no blockage.
Right.
And then there was like, take these vitamins. Like basically it was don't drink, try to like, and it wasn't even that much nutrition stuff. It was more just like, take these vitamins. That was pretty much the only medical advice. And so, of course, we saw the naturopath, and it was like, you got to get on this supplement and whatever. Right. And I mean, at that point, you could have told me to stand on my head and I would have done it, right? Like, I'm sure you've heard that from so many of your guests and your clients, your patients.
The question is, would your husband have done it?
Yeah. And I mean, I think that one thing I have observed, and I know that this isn't the case with everybody, but in my scenario, it was a feeling of a little bit of like, it's a hit to the ego, to the male ego, to be told you're not this virile, fertile guy, you know? It is. And I think that women tend to be a little bit more pragmatic about it and go, okay. And again, I am absolutely generalizing here, so this probably doesn't apply to everybody. I'm sharing my experience. But this feeling of like, yeah, I'm just, you know, I need to do some things to improve this. It doesn't necessarily always equate to my, you know, the fertility piece. I think for some women, they're really part of their self-identity, but I think I think that it impacts men on an ego level differently is really what I'm getting at. And so it was hard, and I know it was really hard for him, and it was a bit of a dark time because there was this feeling of internalized shame, I think. And he grew up in like this pretty macho culture in the US where it was like, hey, you know, like Boston culture, like you're a bit of a sports guy, you're a jock, like buddies, you know, that kind of vibe. So you can imagine it was a bit tricky to swallow that.
Yeah, no, I definitely think that medicine also doesn't make it necessarily easy to be proactive because even when Ryan, my beloved producer, went to go and have his semen analysis, we were shocked that the only things that were tested were motility and count, and morphology and DNA frag weren't even included. So I feel like even when you're given the option of getting a full picture, you can't when you're getting like a male checkup. So unless you're really already delving into fertility because you're having challenges with male factor, you need time to improve if you can improve, and or time to have further testing. So I feel like they're sort of in a position where they are damned if they do, and then they're damned if they don't. So it's the culture, and then it's also the way that we're treating them. So I actually empathize with them if they're willing to make the changes.
Oh yeah, it is. Yeah, it's a tricky thing, and it's interesting too. So at that time, for support, this is what I did to cope, because I felt like I was frankly quite alone in it, because he was dealing with his own emotions, but I was the one that had to go through all of the invasive stuff. Yeah. And it was this feeling of also like, there was a lot of going on like psychologically, in that like I was sort of the coach, I was the health coach myself, and now people were giving me unsolicited advice on how to be healthier so I could be more fertile. And I was like, I don't know if I can swear on this podcast, but I was like, so frustrating because, yeah, it just felt like, why are you all giving me the advice? Why are you all assuming it's because of something that I am doing? Like, there's something's wrong with my body. Like, fuck off. Like, it's not, you know what I mean? Like, it gets me angry now. Can you tell?
Yeah. No, but rightly so. 100%. I also feel like in that instance, even now, so when I did the, earlier last year, I did an initial round of fertility stories, asking for people to give me their fertility stories, and if they were willing to send their pictures or their Instagram handles, so that it's whenever a story has an identity, so that people can actually go and say, oh, this is a real person. They tend to have more people that either reach out to that person or who feel like they can be more akin to the person. So the stories with an actual tag did better. But the most of the stories that were about male factor, the patients or the women who gave me the stories at the end of it ended up writing me back and saying, my husband wasn't comfortable with sharing this, so we're going to have to pull it. Is that okay? I'm so sorry for wasting your time. And in no way did I feel like, oh, you're wasting my time. But it was interesting because you end up feeling so alone because you think that you're the only one because your partner doesn't want to share. So I feel like, and it's also for you, I don't know if this was the case, but for them, they very much wanted to share. And they just felt like they were going to not necessarily like damage the ego, but create more friction if they did, because it wasn't their problem.
And it shouldn't be phrased as, oh, their problem, whose problem. But I remember starting this account like it was a private Instagram account that I just used for fertility, right? Like I just connected and started following the hashtags, and I got up to probably like 300 and something women on there. And we were all going through this kind of at the same time. And I connected with people like, and I sent drugs to people that I didn't need anymore. I mean, within Canada, there's a girl in Vancouver. I swear, I was like, hey, I don't need this Menopur. It's like $700.
Yeah.
I'll send it to you. And she was like, yeah, I'll take it. So literally like, unopened for anyone listening, right?
You're coming out as a drug dealer.
Yeah, I'm coming out. This is it. This is my confession right here. Because it was like, look, this is perfectly, I can't return it. Yeah. I didn't use it.
Yes.
So, and it's like, right. So literally shipping stuff not across borders, but like literally this was like the community that we built. And, and actually one person, a friend of mine moved to Vancouver and now they're friends. It's hilarious. Just the way the world works. Right. So a really powerful community, but I did observe that there can be this almost like hierarchy of like, how bad is it? And then often hearing, oh, well, you only are dealing with, like, it was like male factor was considered like low on the totem pole of like, how bad is your infertility struggle? And so sometimes I felt like, when people asked, it was sort of like, oh, well, you're so lucky. That's all you're dealing with. Right. Like, and I can't pretend to understand what it would be like if I had a host of issues myself. Like I did have polyps that had to be removed. So everything, like I had some stuff I had to do, but like, if you're dealing with endometriosis or like chronic, PCOS or all these other issues that on top of that, I imagine it would be an under layer of challenge. But I think it can be tricky and there's a bit of trauma bonding that can happen. You're nodding your head, yes, in this world where you feel like it's not as bad, so you can't get the support because you're not dealing with it as badly as someone else is.
Yeah, that's so interesting. I hadn't ever heard of that totem before. I've had the comparable between the, if you have secondary infertility, it doesn't even compare to primary infertility. And then it's interesting because people who have had primary infertility then are struggling with secondary infertility and they're like, I'm sorry I said that. And so that's so interesting that the male factor. Did your husband have a community of people that he was talking to? No. So you were it.
We honestly and I don't recommend this, but I just escaped to the support group online and I tackled it like I tackle most things in my life, my professional life, with like spreadsheets and email folders and online calendars. And I was just like, I can't control him, but I can freaking control everything that I'm doing and all the research I'm doing. So and anything time you lack trust, you seek to control. So I didn't trust the outcome or the process. So I tried to control as much as I could. I don't recommend it, but I was very organized.
No, I think that's good. I'm not a therapist by any means, but I think I would do the same thing.
So I was like, who's the best naturopath in Toronto? Bum, 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 bum. Who is the, right? Like, who is the best acupuncturist? I didn't know you back then. And I was like, right? Like I was booking it all. And I was like, I'm going to just mitigate all, you know? So yeah, that's how I tackled it. And we did 3 IUIs. The first IUI was a positive result. And then it was this moment of like, that was all we needed. We just needed to like, yay. And then miscarriage. And then they were like, okay, well, you know, we'll just keep trying. And so I did 2 more IUIs, no result. And they kept wanting me to do more IUIs. And I remember speaking to a friend of mine who had gone through IVF. And I remember crying, sitting in a parking lot in my car, as one does, and calling her. And she was like, Nikki, and these were her words verbatim. And Steph, if you're listening to this, I love you. She was like, Nikki, you got to hit this thing with a fucking bazooka. That's what she said. She's like, think about the probability. Don't waste your time. Just hit it with a bazooka. And I was like, okay. And that was because she's just like, you know, as we know, people listening to this probably know your chances with IUI are percentage-wise much lower than if you do IVF. Yeah. And so at that point, one more little fun detail, I have a heart condition called SVT, which isn't shown to impact fertility at all. But it means that since the age of 14, I would go into cardiac arrhythmia with a really rapid heart rate and occasionally need injections of adenosine to essentially chemically stop and restart my heart. And this is triggered through stress. Well, what's more stressful than going through fertility treatments? So I was at the Hannam Clinic in Toronto, and I remember in between my IUIs, I think it was right like before my 3rd IUI or something, I remember going in, it was like this really important ultrasound, and I had to take the subway to get there, and it was rush hour, and like, you know the drill. And I remember having a coffee because, you know, and I was like, I would go at 7 a.m. on the subway to get my, you know, Wanda, the vaginal ultrasound, and then go back to teach Pilates all day and then rinse, repeat. And I remember finally lying on the ultrasound table and the tech is getting ready. And then all of a sudden I just convert into SVT. And I was like, fuck, here we go. And I'm not anxious about it because I know what it is. But I remember telling the tech, I was like, you're going to have to stop. I need to put my legs up the wall. I'm having like my heart is kind of going into an arrhythmia. It's called SVT. And she was like, didn't know what I was talking about. And she's kind of like, what? And she leaves the room and just gone for a while. And I'm in there and I'm like doing my vagal maneuvers and I'm trying so hard to convert myself out of SVT, like with just the sheet draped over me, right? Like the whatever. And I'm just like, trying hard. And then all of a sudden, I don't even know, it felt like a long time. She brings the doctor in and the doctor's like, what's going on? Asks me. And I repeat myself. I'm like, I'm an SVT. You need to call the paramedics. I need adenosine. She starts yelling at the ultrasound tech for leaving me alone for so long while I'm in SVT. So the paramedics come, literally like 911 ambulance, the paramedics come and they're just like, what's going on? And I'm like, I need 12 milligrams of adenosine, and it's getting hard for me to talk, and I'm like, I can't convert, I need adenosine. And they're like, okay, let's just call this in, because they were not advanced paramedics. So then they had to bring a 3rd paramedic in who was advanced enough to inject that medicine like on site. So of course I am like, there's stretchers in the like fertility clinic, like the whole thing. I'm the drama patient now. And I'm telling you this story to paint you a picture. And they finally give it to me. My heart converts back to normal. And then I was like, well, you got to continue with the ultrasound now. I didn't waste a whole month for that. And they were like, really? I'm like, yes, I didn't waste a whole month of monitoring. And so the paramedics were like, okay, ma'am. Then they wait outside and the tech comes back in and finishes the vaginal ultrasound. And then they're like, we have to take you to the hospital after. I'm like, that's fine, but finish the ultrasound first.
Nikki.
What?
That you took me on a ride.
They kicked me out of the clinic
I
after that.
did not expect that to take that turn.
I know, but they kicked me out of the clinic. And because I was too high risk. And so this was in Toronto. Keep in mind, I live in Toronto. And then they're like, oh, you want to move to IVF? We can't handle you. You're in anesthesia class 3. You're too high risk for us. you need to go to one of two options. You can go to London, Ontario, which is a 2-hour plus drive, or Markham. And I was like, well, I guess I'm going to get a 407 transponder. I'm going to Markham because no one else is going to take me.
Honestly, it's a really good clinic. So I feel like
I loved it.
Your heart saved you.
It's a fantastic clinic. So I drove like on the 407. My transponder bill was quite high for a little while there. Every day.
The hidden cost of IVF.
That's it. Yeah. Toll roads.
Oh my God.
Yeah.
Did your heart condition prove to be an issue in later, when you had to go under for your retrievals?
No, not at all. It was, and I remember my new Dr. Vero at Markham, who's since retired, I remember saying, he's like, why are you here? And I'm like, oh, they kicked me out of Hannum because of my SVT. They said they am anesthesia class 3. And he just looks at me, he's like, whatever, you're not an anesthesia class 3, whatever. And I was like, yeah, well, I guess I was a bit of a liability. They didn't want to touch me. He's like, well, you're fine here. He was just so like, and it was fine. It was never, it wasn't even an issue in labor. It was an issue in pregnancy. It did get worse when I finally got pregnant because your cardiac volume, like your blood volume goes up, your output is higher.
Right.
So that did get worse. And then I had the ablation at 4 months postpartum after my first.
Wow. And then it didn't bother you at all for your second?
No, I was totally fine with my second. But
That's awesome.
So just a little fun. Just that moment where you're like, and I wanted to share that story because like they were so shocked that I was like, no, I still want the vaginal ultrasound because I was like, I am not fucking wasting that entire month of cycle monitoring. Like, do it. And they were like, okay.
Yeah. Because time is such an issue with fertility. Even if you don't necessarily feel it yourself, you're constantly being told about everything in increments of time. And your whole life is now measured in like day
Months.
1, day 3, day 10, day 21, 6 days post-of. Like it's impossible to get away from time. So then when you have little blips of like a casual arrhythmia, you
casual
like,
paramedics
what
in the
next?
ultrasound room. Yeah, there were
I'm
a lot
still
of
alive.
there.
Let's go.
And it was fine. Well, because for me, it's something I've been dealing with for like since the age of 14. So like this isn't scary for me. It's annoying, but I'm like, but I know the medicine I need. It's scary. Everyone, whenever your heart is weird and your blood pressure's plummeting and you're about to pass out, like other people get really scared.
Yeah.
And it's weird in that moment where I am as the patient have to be like, I'm fine. Just give me the adenosine. Just stop freaking out. Just give me the adenosine.
I honestly feel though I probably would have freaked out because they would have been freaking out. So I would have been like, if I pass out, you don't know what to do. Like,
I'm pretty good. Immediately putting your legs up the wall helps with maintaining blood pressure so that you're less likely to fall. So I'm literally like lying feet up the wall with the sheet over me.
Yes. Okay, that answered my second question, which was if you had pants on through any of this.
No, of course not.
I wanted the important piece of information there. You survived, yes, but pants, were they on? Okay, so then when you went to Markham, and this is me just guessing like a common stalker that you are a competitive person with yourself, but I don't know that as a fact. Maybe you're very like low-key yogi because you are like very flexible and you give that holistic vibe as well. So would you say that when you decided that you were going to go for it with the IVF, did you feel like any sense of, doubt, or were you excited? Were you like, let's see what we can do?
I was excited mostly because I changed clinics and I immediately felt more supported at the second clinic. Right. Everything was a bit old school. It's probably changed. This was in 2018, so 6 years ago. I was doing it actually in 2017. So yeah.
Right.
7 years ago now, I guess. And you would still like, there were no, like, H&M before was very much like, it was beautiful, fancy, everything, like iPads,
Yes.
like all digital, whatever. And I went
Yeah.
to Markham and it was like, sign your name on the check-in. And like, it was much smaller and it just felt like I was a person. I didn't feel like a number. And for
Right.
me, that was very, that just made a huge difference. So anyone listening to this, like if you don't like your clinic, change. Like don't hesitate to change. I would say that.
Absolutely. 100%.
Yeah.
Yeah. That was something that we spoke about in the second episode about, finding the right doctor, the right clinic for you.
Mhm.
I do find that a lot of patients, they don't want to have to redo testing
Mm-hmm.
because of the time piece and because of the discomfort and the health anxiety. And so I understand, but ultimately changing clinics, it's like the tortoise and the hare. It feels like it's the slow way, but it's actually the fast way. Go slow to go fast. That was in one of those goofy movies, but it's true.
I see that. I actually, with the previous clinic, I was like, I want all my records. And they were like, well, you have to pay for them. And I was like, oh, okay, so I'll pay you the $75. Give me all of my records. I want all my charts. And they did. And I had to pay $75 for them. And then I went to Markham and they were like, we're going to do another sono. And I was like, here it is. I just did this. And they were like, okay, we don't have to do another sono.
Right.
But the only reason I could advocate for that was because I had my chart, because not all of that would have been faxed over, apparently.
Right. Yeah. Advocate.
Yes.
Buzzword of the year. When you did your retrieval though, did it go well? Did you have any type of complication like overstimulation or?
One thing I loved, and I tell this to so many women because I've had a lot of, since going through it, I was the first one of my friends, and since going through it, I've had 3 other friends very close to me go through this.
Right.
And so the advice, and then of course other people that I'm not necessarily close to, but they're coming to me and they've asked me for my experiences. And a couple of things, I've been in the room when a friend of mine had her retrieval, and I was there, and she was definitely uncomfortable. And this was a clinic in Toronto. And I remember thinking to myself, I'm like, this doesn't seem right. Like, why is she writhing in pain? Because I felt nothing. I had to pay extra for an anesthesiologist to be there. Apparently, not every clinic has an anesthesiologist there. So I was like on cloud 9. I felt fine. And the recovery was quite easy. So number one, I don't understand, and this is just more of a statement, I don't understand why that's not standardized. Women should not be writhing around in pain during an egg retrieval. We have medicine to prevent that from happening. And I've seen it with my own eyes. My friend, really, really having a hard time. And again, my experience was not that because it was at a different clinic. So that, and also I went every day. So it looks like sort of the procedures are different. So when I was going through stims, I was a rapid responder. So they put me on, based on my age, they put me on a certain dose of Menopur or Galutran or whatever it was. And they had me come in for blood work, not every 3 days, but every day. Right. So I was going back, and that was obviously why my toll road bill was so high. But I was going back every day, and my estradiol, I think that's what it is, right? It was like just skyrocketing very quickly. And so what I loved was that the doctor started to scale back on my meds as a result of daily points in time. So it wasn't like he waited 3 days and then they were like, oh shit, you're like really high. He was able to, so after like 1 day, he was like, oh shoot, and he dropped the dose by like a third. So for that reason, I did not have overstimulation. I think they got 16 eggs, like 11 were mature. Granted, I was like 35 at the time, so I was younger. And in my world, that's young for fertility. And so, yeah, I think that those were all the really important factors that I've observed other women didn't have. That sort of very, the doctor was like, no, you're going to come back every day for blood work. I think a lot of clinics don't do that.
No, Vero is the GOAT. like when he
He
retired
was. I mean, he's retired now.
in October, I think it
Yeah.
was 2021.
Yeah.
Like the other doctors at Markham are phenomenal, and they are making advances in other areas of fertility that I appreciate so much, mostly in the unexplained category. But Vero was the standard in terms of very personalized care,
Yeah.
like very tailored to each patient per cycle, not just like, oh, you responded this way last time, you'll probably respond this way this time, and the nurses will check in. It was like he was looking, he was going through it.
Yeah.
He knew every patient and what was going on with them, what was going on with their hormones, what was going on with their follicles. And as someone who is observing, just getting these clinic sheets and having my patients come in, it's very easy for me as like getting a bird's eye view of this compared to what was available elsewhere. Not only was the patient experience different, but the result, the outcome, of course, followed that same upwards trend of good results, good treatment, good results. Of course, that's not always going to be the case because some are tougher, but generally, like that is what was happening. So from a comfort perspective, from a feeling communicated to, like you felt like you were part of the process as opposed to a number, someone who was getting a call. You didn't know when.
Yes.
But you were going to be told at some point information that you couldn't really understand. And then you were to come to the clinic maybe on this day or maybe on that day. The number of people who have missed retrievals because they have already ovulated is actually much higher than one would imagine. And I don't think I ever heard of that happening at Markham. So,
oh no, they were amazing. I truly, and I don't say that lightly. Really, like I remember, like I bought him a Christmas present.
Wow.
I was like, thank you. Yeah.
Yeah. Was part of your protocol to do ICSI or did they do natural IVF?
They did half. So they did. So that was what he wanted to do.
Yes.
And it turned out the only ones that fertilized were ICSI.
Okay. Right.
So we should have technically done all ICSI. I would have had more embryos, but we ended up with ICSI. We ended up with 5 blastocysts, and then Vero's pretty much like everybody has to do PGS. Like you have to get tested, and that's just like you don't really have a choice. Like you have to pay for it. And so we sent the embryos, the biopsied embryos, to the States for the pre-genetic screening, and 2 came back chromosomally normal, and the rest were not even mosaics. Like they were never going to be viable.
Right.
And so, and so those 2 embryos that I got turned into my 2 kids.
Wow. You had 100% transfer success.
I did.
Nikki, all of your greens and protein really paid off.
I was like, literally, this is me, like uterine lining, pomegranate juice, like all the things. I was like, what do I need? I was Johnny on the spot with it. But I remember Vero saying, he's just like, he looked at my chart, and he did my first transfer. And he looked at me, he's like, very seriously, he's like, you have a very good chance. And then he did it, and then he goes, it's in God's hands now, and like walked out the door. I remember verbatim what he said. You have a very good chance. The deed is done. It's in God's hands now. Bye. And like walked out.
That is very Godfather.
Yes. He's like the Godfather of fertility. And he looks like a bit Richard Gere. Like he's a very handsome older man, which can be jarring for some.
Yes.
But I was like, oh my God. Yeah.
I would have been jarred. I'm jarred on a good day. That would have completely thrown me off.
I know. It was funny.
Yeah, it's interesting because Markman's the only clinic that will do the half-half.
Oh, interesting.
And I think it's a really good protocol when you don't know the sperm, because if it was, let's say he had like just average to low DNA frag, then there's a theory that eggs can actually repair DNA fragmentation if it's sort of given the opportunity, not necessarily to choose the sperm, but the egg has more control than what's truly understood. And so the idea of the egg understanding, what sperm would be best to let in, there's some enzymes that are involved. I'm going to actually post the actual process because it's really interesting. As opposed to when there's really high DNA frag, most people, they think that when you are looking at like your Petri dish of sperm, that you can actually select like, oh, that one looks good. But you can't. It's like fish in a tank, except much, much smaller and much, much faster. Like you're just sticking your needle in and hoping that you can get DNA into your needle. Wow. Nobody's able to actually see like, oh, it was that sperm right there. Like, and even if that's the case, you can't necessarily tell if DNA frag is an issue. So there is no like choosing the golden boy. It's just hoping that you can get one of the wash sperm and then injecting it in. So it's a lot less exact.
What's high frag? What's considered a high fragmentation? I think ours was 30 something. Is that high?
That's quite high. Yeah.
Okay.
So I would understand why, because if you do have really high frag, then you have a Petri dish of, 30% of them they're going to have fragmented DNA, which some eggs might repair, but some might not. And so doing ICSI, where it's just a guarantee that you have no idea which one you're going to get, there's some thought around potentially natural selection, and the sperm and the egg being able to figure out who's most compatible. But it is interesting because after, I don't know, it's been about 10 years now, ICSI, even when I look at the studies, they say, it can't necessarily help with DNA fragmentation. But when I anecdotally look at my patients' results, it does appear to be like a helpful tool. Which is also so funny why it's like, if you have relatively high DNA frag, why would you do an IUI? You know what I mean?
Oh my God. And they kept wanting just put me through it, like keep going. And this is another thing that kind of bothered me because I've always very regular 29-day cycle. I'm going to ovulate on day 15. Like I know it. My LH surge is coming. I can feel it in my body. Sometimes I can tell you what side I'm ovulating from. Okay. Wow. That's just my experience in my own body. And they kept trying to give me was it Ovidrel?
Yes.
And I was like, I don't need it. I'm going to get my surge in 2 days. And I'd have to be there like, no. And I'm like, you're just trying to rack up your billing. Like it was about $500 each time or something. I don't know what it was, but I was like, I don't need it. And they're like, fine. And then sure enough, 2 days later, I'd go in for blood work and they'd be like, you're getting your surge, come in tomorrow or whatever. And I'm like, yeah, I told you. And I had to keep saying that each time because I just didn't want to have the unnecessary triggers. I just was like, no, I don't need it. I'm going to ovulate on this exact day. I can give you like a 12-hour window.
Yeah. Wow. Yes. No, it's so true. And even from that sperm perspective, it's really only appropriate for one type of male factor, which is really high count and really low motility. So if like morphology is an issue, especially like head shape, it's not going to help. Like they need help getting in the egg.
And this is where I hear stories of some women who just do like 8, 9 IUIs. And I'm like, oh my God, like it's just, it feels like the clinic's just making money. Like, what is this? How come no one's giving these families better advice?
Well, it's also in that instance, there's a lot of conversation around how if 3 IUIs doesn't work, then just move on to IVF. And I actually learned from our second guest, a physician, that in the States, you have to do 3 IUIs before they'll let you do IVF for insurance purposes. I don't think that's the case here, but
No.
it ruins the IUI stats too, because for some patients, like I had one patient who was getting this stat where like her husband's morphology was great. His motility was only 20%, but he had 500 million sperm. So in that instance, where you have good morphology, low DNA frag, really high count, IUI is a great option. And that's, you're not going to have the same like low success rate as someone where it's unexplained, where morphology and DNA frag is an issue, or where there's other like female related issues. So I feel like it contributes to the bad rap. IUI for most people is completely inappropriate for a fertility treatment. But then for those where it is actually applicable in that male factor, like it's a godsend. The tailoring, it's all about the tailoring to the patient.
Which does not happen often enough.
No, not at all. I am going to use that line, it's in God's hands now. I may use it several times today. I have clinic. I think I'm just going to put needles in people, be like, it's in God's hands now, and walk away.
It was very much like this moment. It felt like this moment of gravitas, you know? And I was like,
yeah. And then obviously you're a pregnancy and postpartum wizard.
I love you.
You are.
You're funny.
It's insane. Sometimes I'll go onto your page and I'll wish to be pregnant again. And anyone who knows my pregnancies will tell you that that's quite something. They were terrible. And I watch you hugging the baby with your very strong abdomen. And I'm astounded.
I mean, having a Pilates practice before you get pregnant certainly helps, but I would say that it's never too late. Like I really just wish for everybody to have the tools that they need to have their best possible birth, whatever that looks like. Whatever. If you want the unmedicated home birth, the water birth, if you want the medicated epidural birth, if you want planned C-section, like whatever it is that you want, you should feel supported and respected and heard in those scenarios. So that's sort of the place I'm coming from in terms of the way that I teach.
It feels that way. Very much so. I love how much you discuss birth prep because like in my own experience, I found that when I worked on actual positioning and using the exercises actually that you post, I spent a lot of time on my hands and knees.
Yeah.
And it sincerely really helped with those last 4. Like they were ginormous children and I had no tearing and I don't wet myself, which is honestly astounding.
Yeah, there's so much. I mean, there's so much that has taught me in my own medical journeys. So my heart stuff from a young age, which is often misdiagnosed as anxiety. So a lot of young girls that are healthy, it tends to affect a lot of women and a lot of younger healthy women, this SVT issue with arrhythmia.
Yes.
And a lot of the times you're told, oh, it's just anxiety, calm your nerves, when it's an actual like duplicate electrical pathway in your heart. Like it is not just anxiety. Don't gaslight me. But so I've dealt with this for the vast majority of my life, plus going through IVF, plus these medical situations in my life, which have really shown me the importance of developing a trusting, mutually respectful relationship with your care provider. And if you don't have that, you got to switch care providers. And it's okay to ask questions. In fact, it's imperative to ask questions and advocate for yourself. And so I bring that into my work with women who are pregnant because I think I know we have been conditioned to be good patients and to not be a bitch and to, just sort of follow doctor's orders. And, and it is not leading to good birth outcomes. It's just not. We need to take back birth, frankly, in a way where it's like, no, I should not be told I have to push on my back because that's the only way that you've been trained. In fact, here's the printed evidence to show I should have absolute autonomy over my birthing position, even with an epidural. And even in an emergent situation, I should have the ability to have a moment of informed consent. Like, this is basic, but it's revolutionary in some spheres, you know? So, and this is what I try to kind of say, listen, whatever you want to do, it should be your choice. However you want to push, breathe, you know, positioning, all of that. Here's the evidence to help you advocate for yourself if you're getting pushback.
Yeah, I feel like that comes across so strongly, and also your facilitating of body belief and the communication. Like your exercises involve the baby, and I know that sounds like an obvious statement, but in most of my exercise history prior to being pregnant and then becoming pregnant and being pregnant, it was like I was exercising, and I was exercising as me, and the baby just had to come along for the ride. And I feel like, and they've all come out a little shook up. And I feel like your programs are a lot more, they give the mother and the baby a bonding before birth. You're working together as a team to strengthen the core and to prep for labor, as opposed to just running a half marathon and wondering why you're tearing so badly when you're pushing on your back.
I mean,
hypothetically, anecdotally.
There's so many things I could comment on there, but I believe that a lot of women, and I'm a product of like high school in the 90s, early 2000s, like, you know, and a lot of this sort of, and where I'm going with this is this idea that we need to like push down the sensations that our body is giving us, to go on a diet, to wear the uncomfortable shoes, to, you know, cover up the pain that we're having from our periods, because we want to be, you know, essentially even keel like for the entire month, right? We don't want to have a down week. We're just going to push it down, push it through, you know, who cares how it feels? What matters is what it looks like aesthetically, you know, from a position of how's that person coping, right? Don't see the weakness, or don't let them see the weakness. So I think that's sort of part of the narrative, at least that I got growing up. And it's no wonder that now when you have a group of women who are pregnant, and I am teaching them to connect to their pelvic floor and to breathe a certain way, it can be very difficult. And the advice of listen to your body isn't enough, because how is someone supposed to listen to their body if they have really been conditioned over many years of their life to disconnect from their body because of pain, because of being hungry and not wanting to eat, because of this desire to disconnect? And so a lot of the times, I mean, I had it last night, I taught live, and I had someone say, I'm finding this breathing really frustrating, and then I get emotional, because she's so having a hard time allowing the inhale to expand. A lot of us are constantly in this, like, I'm going to inhale, hike my shoulders. It's this sort of upper chest stress breathing, like sympathetic nervous system breathing. And I'm like, you know, and the advice I give to her was like, listen, if you're feeling frustrated, pause. Like, if you're coming into this work feeling frustrated, I want to acknowledge that it's not uncommon for you to feel that way, but you don't want to then push yourself through. Like, you cannot continue to sort of like push your body to just sort of really just listen to your demands. We have to come from this place of working with your body and learning to connect in a way you've probably never connected to it before because of how we've been conditioned, right?
Yeah. No, 100%. I went to a training session this morning, and I came home and I was so pissed off at my trainer because he made me breathe through my exercises. I said to Yavor, I was like, I wasted an entire hour breathing. He was
really?
like,
you said that. And so why was that frustrating for you? Let's dive into that.
Well, I was like, I burned 200 calories and I sweated not at all. And I spent the whole time learning where my core was. And Yepper goes, you should know where your core is. Like, how do you breathe? I was like, I don't know.
Is to give them the burn, give them the sweat, and then when they're asking for a break, I sprinkle in the breathing education, and then I kill their butts again or their core, whatever, and then sprinkle in the breathing education. Because if I had a class of people just breathing for half an hour, I wouldn't do very well.
Honestly, I would have loved a sprinkling. It did make me kind of realize that I probably I didn't really. He was like, "Where are you feeling that?" I was like, "In my Adam's apple."
No. Oh my God, I need to get into class.
Like,
girl.
do I have a thyroid concern? I'm like, that's as far as my breath goes. Down right to my thyroid. Anyway, okay. Nikki, you have been an absolute delight. This is more than I could have ever asked for, because you were talking about an issue that I'm obsessed with, which is sperm. And you did so with such eloquence, and you were so articulate that people will listen to this podcast and think, wow, that was a really articulate podcast. And it's because you did such a good job. So thank you. I appreciate it so much. Your story is going to help so many. And I really hope that it will allow because so many women are saying to me, oh, I listened to your podcast with my husband and I pointed out this, and that to them. So maybe when they're listening to this podcast with their husband, and if this is their issue, they won't feel quite so alone. And I think that is an invaluable experience.
Yeah, I hope so. I do. I really hope so. And anyone can obviously reach out to me. But I want to say, Anne, like, you are an angel. And I wish that I had known you when I was going through this, because you would have been so incredible to have. You're an absolute dream person to have on anyone's fertility team. So thank you for everything that you do.